we've already talked about frequencies. Now we're going to discuss what to do whenever that frequency ends. So let's say I set a patient's frequency at 2W8, so 2 times a week for 8 weeks. Well, at the end of that 8th week, the frequency is about to end, and we have to determine if we're going to extend with the patient and continue treating them, or if we're going to discharge them. And that decision is completely up to you. So when it comes to the last visit of the frequency, which would be the 2nd visit of the 8th week, you have to determine what you're going to do. If you think, okay, this patient needs to continue therapy and they need to receive more treatment, well, what needs to happen is in your visit note, it needs to be documented as an end of frequency re-eval. And within this visit, you need to write why the patient needs to be seen for more visits, what progress has been made, and how long you're going to continue to see this patient. And all of that needs to be included in that last visit. Once you have an idea of what your new frequency is going to be, you need to notify our office so they can do the same process as they did when they submit initial eval frequencies. They then take your new re-eval frequency, put it in the system, send it to the agency, they send it to the insurance company, and then we have to hear back until you can see them again. So the same process as with initial evals is before you see them for follow-up visits on your new frequency, you want to make sure that we have authorization. So, because sometimes, as you know, it can take a couple days, but sometimes it can take a whole lot longer. So be sure to confirm that you have authorization before you go. If you determine that the patient needs to be discharged, that they're done receiving therapy, they've maxed out, they've met all their goals, whatever it may be, you document that as a discharge note or a DC note. Within this note, it needs to say what progress the patient's made, if there's any objective measurements that could be helpful. You also need to notify the nurse that you're going to DC, as well as notify our office. Because what our office does with that is we then put it in the system, notify the agency, and then the agency closes out the patient chart. So all of that communication is super important, especially when we're going to extend or discharge, because the way the patient's plan of care is set up is dictated by whatever you do. Additional communication is very helpful, but be sure to notify our office what your plans are whenever the frequency ends. And again, that's documented as an end of frequency re-eval or a discharge visit.